Everyone, and welcome to the Institute for Global Prosperity's Directors Seminar. I'm Henrietta Moore, and I'm the founder and director of the Institute for Global Prosperity. I'm delighted that you are all with us today. It's a special event this evening. It's the first in a series of joint events which we're doing between the Institute of Global Prosperity and the Development Planning Unit at University College London. We're here together today to talk about one of the most important zoonotic infections of our time. I'm going to begin, first of all, by introducing our two distinguished panelists, and then by asking Professor Michael Walls, who is the director of the Development Planning Unit, to say a few words about the intellectual architecture of our endeavours. So our two panelists this evening are Professor Eric Fevre, who's Professor of Veterinary Infectious Diseases at the Institute of Infection and Global Health at the University of Liverpool, and is currently jointly based at the International Livestock Research Institute in Nairobi, Kenya, where he's managing several field-oriented projects that look at the relationship of infection for nutrition and health and agriculture. He leads a group of epidemiologists interested in the biology and control of emerging diseases, particularly zoonoses, with a focus on understanding the factors involved in emergence, risk, transmission, persistent spread, and the disease burden of pathogens in both human and animal populations. Professor Fevre is chair of the World Health Organization group on zoonotic neglected tropical diseases, and participates in a wide range of WHO-related activities. And our second panelist this evening is Professor James Wood, who is head of the Department of Veterinary Medicine at the University of Cambridge, and Albarada Professor of Equine and Farm Animal Science at Cambridge. Professor Wood is a veterinary epidemiologist, and he studies the dynamics of emerging infectious diseases, including viral infections in fruit bats in West Africa, mammalian influenza, rabies, and bovine tuberculosis. And Professor Wood and I have been working together for a number of years on bovine tuberculosis in Ethiopia. Professor Wood combines mathematical modeling and more traditional epidemiological approaches with detailed molecular studies of pathogen-host relationships in a multidisciplinary framework. And in addition to his many research interests, he's also involved in the Cambridge Africa program, which focuses on building links between Cambridge and African higher education institutions. So welcome to you both. I'm delighted that you're here. But before we get into the discussion, could I just hand over, first of all, to Professor Michael Walls, who's director of the Development Planning Unit. So Michael, please, the floor is yours.
Thanks very much, Henrietta. I just want to say a very few words really about the collaboration. The Institute of Global Prosperity and DPU bring different perspectives, but a huge degree of overlap. And for that reason, I'm really delighted to have this opportunity to work together. The focus is on an important policy issue that of course affects national and international development, and in which urbanization is a key contextual factor. But it's also one that is so central to our efforts today to understand the origins of health crises, not least the one we're all living through now, although that's not the immediate focus. DPU on our part, including through launching a master's degree in health and urban development, I believe brings a great deal to the table here. A few years ago, as I said, we launched the new Masters in Health and Urban Development, and it's given us the opportunity to collaborate closely with colleagues across the biological sciences. And our 67 years of working in the Global South also adds, I think, a necessary dimension. Indeed, I'm pleased to see Professor Eric Fevre back with us today, as we started working with him when he was principal investigator on a 5-year research project entitled Epidemiology, Ecology, and the Socioeconomics of Disease Emergence in Nairobi, in which Professors Julio Davila, who's with us today, and Adriana Allen were also involved. So echoing Professor Moore's comments a moment ago, IGP, of course, bring an equally rich background to this collaboration. I'm really excited to see where things go from here. I'm looking forward to the opportunity to work together. It's not for nothing that I say that these different perspectives inform this work richly, and I look forward to continuing our collaborations in the future. In fact, I know there are 2 more events in this series coming up. The second will take place in late March and will focus on new approaches to the urban. And the third will be on mental health, and I believe takes place in May. I'm going to hand back to Professor Henrietta Moore now to introduce the first of the speakers. Thanks, Henrietta, and thanks everyone for being here.
Thanks very much, Michael. That was great to give a sense of the range of the intersections between the IGP and the DPU, and the importance of us getting together and chatting about these issues more systematically. So I think we should get right into it. Once we've had the main panelists, there'll be a little bit of discussion, and we have 2 responders. As we've just heard, Professor Julio Davila, who's Professor of Urban Policy and International Development at UCL and works on urban zoonotic infections and their consequences for health and development. And Simon Yakabi, who is a Senior Research Fellow at the IGP and has been working closely on a number of issues on food and health, but most recently on the bovine tuberculosis project in Ethiopia, looking particularly at farmer-led initiatives for the control of infection and for surveillance, etc. So let's get right in it. So can I ask you, Eric, to lead off? Would you be willing to do that?
I'm happy to, but I believe that James will start off.
Oh, James wants to do it now. You keep changing, yes. Guys. Who's going first? James, are you going first?
Yeah, Julio told me that I was, so I
right.
followed.
In that case, apologies, Eric. James, will you please lead off? Yeah.
Yeah, thank you very much. And it's a great pleasure to be here. I'm delighted to have received the invitation to talk at this, what I hope will be a very interesting conversation. I want to talk about emerging infectious diseases with a focus on what happens at the animal to human interface, and in particular thinking about how the world is changing, how we change the way that we're living in it, and thinking that therefore somewhat a little about animals in cities as part of this, with a slant there. I talk about principally about zoonoses. Zoonoses are these infections that we're all far too familiar with today, in that they are the infections that move, that jump from animals to humans. And in fact, we think about zoonoses very much around the animal to human interface. But the reality is, of course, that we are animals to start with. But the 60% of human infectious diseases, all of them, have been reported to have zoonotic origins, i.e. come from animals at some point in their past. And those that are emergent, now that's not to say that they'll stay around forever. And I think we'd all hope that COVID-19 doesn't stay around forever, although it might well. 75% of emergent diseases are those that come from animals. So that's one study that's reported that, and other studies have come up with variations using different methods around this, but the ballpark figures are broadly consistently. And I think a very important angle here is that nearly 3/4 of emerging infectious diseases have a wildlife source, and that proportion has been increasing. And obviously, if you accept that COVID-19 is a disease that's come from wildlife, the fact that that percentage is increasing is reflected in this emergence event. So we think, when we're thinking about zoonoses, we think about different sorts of infections in terms of those that really just stay in animals and aren't zoonoses, but those that may infect a human, but then don't transmit between humans. There are others, and viral diseases such as West Nile virus, which is a problem in the southern Mediterranean, and a substantial problem across North America over the last 20 years. These are infections which are spread amongst wild birds, in this case of West Nile, and which when they infect humans, typically do not transmit on, either through vectors or in any way. There are other infections, such as monkeypox in the Congo Basin, which is a viral infection of wildlife, probably of rodents, despite its name, which may cause chains of infections in humans, but they do not persist, and that they are removed they are removed by controls and measures taken from the human population. And then the fourth category is zoonoses, are those infections that become adapted in humans and then become human diseases. And obviously COVID-19 would seem to be one of those, but pandemic influenza comes originally from typically a bird reservoir. We talk about these as if they're different zoonoses, but the reality is that all of the differences really just reflect what happens when the infection, be it a bacteria or a virus or any other form of infection, gets into the human. And the actual zoonotic stage, which I'm going to refer to as spillover in this talk, is pretty much identical for all pathogen groups, despite the consequences between those four groups being so radically different. Now, there are two key areas that I want to just draw to your attention. Some relates to whether or not the bug, the pathogen, is or can become quickly enough adapted to the new human host. And the others relate to the host characteristics, how much we mix, therefore, what are the infection opportunities for that pathogen? And that reflects density and mixing patterns, which is why lockdowns can be so effective, as we found out over the last 18 months, unfortunately. And all of that is against the background of the infection, the bug's capability of replicating and transmitting between humans. And for example, with the same bug, you can have radically different outcomes. And the example I use here is Ebola virus. And I'll come back to this a little bit because it's an infection that we have studied in this way. There is no evidence that Ebola virus is any different between the single cases that occur just when, say, hunters may have contracted the infection from wild animals that they might have hunted or sourced from their forest floor, and those that have caused huge outbreaks either in DRC or in West Africa 6 or 7 years ago. So what stops or what determines a bug infecting? And the Swiss cheese model has become very popular in terms of COVID emergence, but actually it was used, it's been used a few times to describe this, but there's a very nice exemplar of the different barriers or things that need to be all aligned in order for an infection to get from a reservoir host, perhaps a wild animal, into humans. Not only are these barriers, but also these the different ways that the dynamics of infection can operate at these different levels of cheese can determine whether or not infection is likely to transmit on. So the reservoir host has to be in contact in some way, directly or indirectly, with humans. There have to be enough of them for it to be likely that there's enough capability to carry enough infection that has to exist. The pathogen prevalence has to be high enough in order to exist, and then infect through the animals into the human population. And therefore, the infection intensity becomes very important. And so, in a very intense infection, perhaps with a seasonal peak of infection in wild animals, you're more likely to get pathogen release from the reservoir host. And that proportionately then may increase the likelihood of the pathogen surviving long enough to reach humans, however it reaches them. Now, within humans, you have all sorts of structural barriers like skin that generally stop infection getting into us. But when the barrier for that infection is breached, and it's skin in the case of rabies with a bite, but it might be a respiratory surface in the case of a respiratory infection like COVID-19. Then we have non-specific, very powerful innate immune responses that control the vast majority of infections that we meet, but not all of them. Some of them get through and replicate, and then they can start replicating in humans. And if they replicate in humans and then get released, then you can have spillover and onward transmission. But all of those things have to align in order for an infection, a spillover event, to occur. So drivers of between species or interspecific transmission are influenced then by all of these, the things that can affect these different layers of that cheese. They're going to be different in every environment for every different infection. But basic rules are followed. And that if you have much more infection in the animal species, it's much more likely to get out than if you've got a very rare infection in the animal species, and so on. Against all of these things, then there are other longer term drivers that may make spillover from animals to humans more likely. And that could be changes in the population structures of animals, changing human behavior, and a longer term trend that we're all concerned about is biodiversity loss, which may make species that are more likely to carry nasty pathogens to be in contact with humans. A lot is spoken about disease reservoirs, but actually every animal species, including us, has the ability to carry infections which can transmit to other species. And those species may or may not get ill or very ill with the infection. Disease reservoirs, people often come up with hugely complicated definitions of what a disease reservoir is, which I don't want to get buried in here. It's just a term used to denote what happens a species that may be carrying an infection that can transmit to another. Now, where these infections, and this is just focused on infections that came from wildlife, and this is a paper that's a few years old from Kate Jones within UCL, who has risk mapped this over all known emerging infectious diseases. And you can see that there are some real hotspots in terms of where wildlife infections are likely to transmit to humans. And that reflects the abundance of different species, different pathogens within the different species, and different distributions of humans and interactions between those humans and the wildlife species. And you can see it's very patchy. So thinking about spillover and detection, I want to now just talk a little bit more with a focus on bats and viruses. And one reason that we have focused on bat viruses is because bats carry a number of very nasty infections, and they are said not to suffer disease from them. Now, in fact, that's not true. It's actually just very hard to observe disease in wild living bats. And certainly for one infection type, the rabies type viruses that many different bat species may carry, actually will kill bat species, but only relatively rarely compared to the large numbers of bats that may get infected and then recover from them in a way that we don't see typically with other species groups. And we don't have a full understanding of why different bat species may be so resistant, but it's a combination of life history traits in terms of how a population can carry the infection, and some pretty smart immunological mechanisms, the different innate immune responses that bats may have that enable them to cope with very nasty infections, these nasty in other species. But I think to remember with bats is that a number of very nasty viruses that have killed humans, and I list infections that have been obvious in the last 30 years. Many of them have actually transmitted into humans through intermediate hosts. So they infect one new species, and Nipah virus first spread to humans through pigs, with a big outbreak in a pig population in Malaysia in the 1990s, which then transmitted on to pig farmers. And that's not untypical for the way that zoonoses may emerge from wildlife. We don't know how SARS-CoV-2, which appears to be a bat virus, got into humans, but and we may never know that. One reason that bats are also interesting is the amazing population dynamics that they have, where you have millions of the same species cohabiting. But I haven't really got enough time to go into that. But with some of these bigger bats, though, in parts of the world, they are very important sources of protein for people. We've studied bushmeat in consumption, bat bushmeat consumption in Ghana, and actually found that each year, prior to the Ebola epidemic at least, over 100,000 were being consumed in the capital city alone every year. Now, these bushmeat is important for some form of viral transmission, but actually what's interesting with this bat and what our studies demonstrated is the vast majority were traded after heavy smoking, which is a form of preservation, which was very likely to inactivate most viruses that we might worry about. However, some are consumed fresh, but the greatest risks with bushmeat come around butchering and hunting, which is far more risky than consumption. Sorry, there's a mistake on my slide there. And so this is an example here, which I think speaks words for how bushmeat hunting actually often exists in sub-Saharan Africa. This is a bat bushmeat hunter. You can see he has no stall. He is undertaking this to supplement his income. He has no stall here. I mean, typically these people are very poor. They're looking to supplement family income. And so if you're going to think about just banning these things, then you have to think about other livelihood sources. Something I draw your attention to amongst this pile of bats is the one in the bottom left is still alive. And so hunters are typically the most likely people to be bitten or scratched by the animals that they've caught. And so these group would be one of the riskiest in terms of picking up new zoonoses from wildlife, which is why they have been studied for the emergence of infections like bat viruses and HIV and so on. So then thinking about studies of disease emergence, I want to think about a little bit how good are human surveillance data? Because a key defense against disease emergence is early detection. If you can intervene when there are very low case numbers, then you have a far greater possibility of doing something about it compared to when there are hundreds, thousands, or tens of thousands or more, by which time it's probably too late in terms of stamping out such an outbreak. So early detection requires surveillance, and that needs good primary health care if it's going to be systematically successful, which has got to be underpinned by specific laboratory capacity and access to that laboratory capacity and excellent communications. And that is quite a tough ask in many low and middle income countries. I wanted to give you one example that my colleague Freya Jeffcott has described of human health seeking behaviours in a part of central Ghana, which is one of the poorer parts of Ghana, but Ghana in sub-Saharan Africa is thought to have one of the best primary care delivery services, albeit Brong-Ahafo is one of the regions which is perhaps less well supported than others in Ghana. Freya did an ethnographic study for nearly half a year and looked at different patterns of healthcare usage in a number of families that she worked very closely with over this period. What she found was when people sought help for their health from clinics, in pretty much all instances, there was a lack of good record keeping in the clinics, somewhat variable communication between doctors and patients, frequent retreatment for febrile fever illness, which would not be uncommon in the region. But it was frequent retreatment with the same drug when people came back having been unsuccessfully treated in the first case. There was only really one opportunity for a single diagnostic test, even if there is quite good laboratory access capability elsewhere in Ghana. And that laboratory test was typically just a malaria test or not. And overall, frankly, there was little or no chance of detecting emerging infectious diseases until a big outbreak might occur, in which case other forms of surveillance would kick in. But the ability to detect spillover events is close to zero in this region. And I'm going to show how this is clear from Ebola surveillance data. And so this is work that Emma Glennon did with us in Cambridge. using all data on all Ebola outbreaks that have been published or reported to WHO and so on. So we know how big the detected outbreaks are, and we know how transmissible Ebola is from the outbreaks that it occurs, when it does occur in outbreaks. So we should be able to, from first principles, to predict how big the outbreak distributions should be, how many small ones we should see against how many of these bigger ones. And what we see is that the outbreaks should be reflected by this green line in this graph here. So the vast majority of outbreaks, because Ebola is not particularly contagious, should be just 1 or 2 patients. But what we actually see is in graph C is the distribution of genuine outbreaks is described by this grey line. And that is because Ebola outbreaks are only detected when they start transmitting and it becomes more obvious that they are Ebola rather than just people dying, often of gastroenteric or systemic illness. So to summarize that, the probability of detecting outbreaks is less than 10% for a case that doesn't transmit, and at least half of all spillover events have failed to be diagnosed since Ebola was first recognized. Now, I think that's a primary case for the need internationally to invest in primary healthcare in regions where zoonoses may be particularly important. Obviously, and this is the subject of this seminar, populations are becoming increasingly urbanized. Now, animal contacts may be reduced for many because not everyone then is involved in agriculture, but peri-urban farming is becoming more prominent. Dairy is seen to be increasing in many parts of sub-Saharan Africa, and there are pigs and poultry seen in many parts of the region too. What are the consequences for spillover, though, in terms of peri-urban farming? And I know that Eric will talk in much more detail about this. As Professor Moore said in the introduction, we've been working on bovine tuberculosis in Ethiopia as an exemplar in the dairy industry in Ethiopia, of an exemplar of what might happen with a semi-intensive industry producing milk for a growing urban population. What we see in parts of the world, and this is most of sub-Saharan Africa and a lot of Asia, is that bovine TB infection is widespread with a variably but often high prevalence in cattle that are being used for producing milk. And that can be a problem because this infection can be transmitted through milk if it's not pasteurized. I don't want to run into the details of why infection prevalence can be so high, but there are a number of risk factors that predispose peri-urban semi-intensive farming to have a high prevalence of bovine TB. This disease is controlled by test and slaughter programs in the Northern Hemisphere, in the global North. Animals are regularly tested where the infection is known to be present, and infected animals are taken out so that they cannot transmit to other animals or to humans. There is no provision to do that in many parts of the world, either because of lack of resource or because of cultural constraints, such as the status of the cow in India. Risks of bovine TB, which is an important zoonosis in some parts of the world, not least where it's been carefully studied in Mexico, where it's very important. Transmission can come through milk or potentially meat, but particularly milk when it's not pasteurized, but also through direct contact with infected animals, which may excrete the infection through normal respiratory means. And this means that those people who are most at risk are those that are looking after the animals. And without going into the details of this, they're particularly difficult to study, at least in Ethiopia. And what Henrietta's work has demonstrated is a huge, with our collaborators there, it's a huge turnover of staff on these farms, which makes follow-up to determine their infection status for the slow infection, which may take some months to appear, extraordinarily difficult. Other risks in India relate to the very close contact between, because of the status of the cow, between infected cows and the people who look after them, who own them. It is worthwhile noting that there are estimated to be more cattle infected with bovine tuberculosis in India than the total number of dairy cattle in all of the US. That is the extent of the problem and the risk potentially for the human population there. So I just want to show you some images of what peri-urban farming looks like in southern Ethiopia around Awassa from a trip from a few years ago. So as you'd expect, outside the city, there's a lot of small ruminant farming. And then the dairy farms themselves, as you can see, this is relatively intensive with cattle being kept and fed and milked inside in a barn. This gives great opportunity for transmission between cattle, but also between cattle potentially and the people who look after them. Other farms may have a little bit more space, and this is one that's a little bit slightly further out, where it's right on the margins of arable farming and the city boundary. And other cases, the farming was right in the middle of the city, where you have traditionally built barns housing the cattle that are being used to produce milk. And there are all sorts of constraints to this sort of farming. And actually in this particular one, the greatest problem they had was getting enough water into the cattle to enable proper washing, and as well as nutritional requirements of dairy cattle for large amounts of water. So what do we do about controlling it? Well, the traditional ways in the north are just not going to work. They're not feasible. Luckily, in most parts of the developing world, we don't need to worry about wildlife reservoirs for bovine TB. But a second host, and that might be the human, might complicate controls because of potential for transmission of human TB to cattle and vice versa. But there is, on the plus side, huge opportunity for vaccination using BCG vaccination in cattle, where we don't need to worry about testing, surveillance testing of live animals, which is used so much in the global north. So that was really what I wanted to talk about in terms of peri-urban farming and some of the risks of it. I didn't talk so much about the peri-urban nature of those bat populations, but the large bat population of up to 1 million of those fruit bats that we've been studying in Ghana is right in the middle of the capital city in the seasonal times when those bats are there. I mentioned biodiversity loss as a driver of spillover. The evidence for this is not so strong, but it's growing. And I think that we need to look very carefully at trying to stop further biodiversity loss, because this is going to be a greater problem in the future for all sorts of reasons. And this is just one other reason why we should look to constrain any further biodiversity loss. A key point is that mammalian species that harbour more pathogens are more likely to occur in human-managed ecosystems. And that's a kind of take-home message that's come from, again, this is work from Kate Jones's group, which is well worth looking into if you have an interest in this. We have to be very careful, I think, when people like me are working, like us on the panel are working with authorities in the global south. Emerging infectious diseases have variable significance for public health. It's very important to consider epidemic potential, which is a global concern, against endemic burden, where other health priorities may appear to those concerned with public health to be much more important locally compared to our concern about epidemic emergence of disease if we're worrying about what might happen in the tropics while we sit here in our warm houses in London. Something I've not focused on so much, but I think that livelihoods are one of the greatest risk factors for any spillover. And not only is avoidance of risky behaviours much harder when you don't have sufficient money on a predictable basis. But it's just impossible sometimes to remove yourself and your family from these risks without other forms of livelihood to replace what might be a risky behaviour that you use to pay for food for your family. I won't dwell on the acknowledgements. All of the work that I've done in this space has been with many other people. I've talked about, Henrietta and I've talked about the work that we've done together, and Kate Jones has been a great collaborator. These are the other people that I've worked with over 15 or so years who have been very valuable in terms of sharing ideas and all things generally. Thank you very much.
Thank you, James. Wonderful. Thank you very much for that. But I think what we should do now is go straight into Eric and have his view, and then we'll come to Julio and Nyokabi. So Eric, please, can I offer you the floor?
Thank you. Yes, I'm just trying to get my screen sharing organized. Can you confirm that that is now as it should be?
Yes, that's absolutely fine. Very nice. Yeah, great.
Great, thank you. Good, okay, well, hi everyone. Thanks very much, James, for those fascinating thoughts. Some of what I'll say will follow on directly and overlap a little bit, and then there'll be some other elements that focus somewhat more on the food system as one of the interfaces that we need to consider. So I'm talking to you from Kenya this evening or this afternoon, and a lot of the work that I'm going to present is informed from studies that we've done here. So I won't dwell on this too much, but I love this figure, and I'd like you to see it. This is a figure put together by colleagues at the University of Liverpool that really just show the cloud of connections that different species have between each other. So every node in this cloud is a species, and every line is an infectious disease that connects it to another species. And really what it highlights very nicely is that we live in a cloud of shared pathogens. And it's very important, of course, to understand that pathogen sharing and how different species interact to share those pathogens. So we've had the definition of zoonoses. I think one important thing to add is that the ability to infect multiple hosts biologically is a really important fitness strategy for organisms. The more hosts you can infect as a virus or bacterium, the greater your ecological niche is. The bigger it is, and the more likely you are to survive. So we have to understand the behavior of pathogens in that context. And a lot of the efforts that we put into controlling them then go into trying to prevent those jumps between species. Okay. And then in terms of the emergence of pathogens, again, just paraphrasing a little what James said in a slightly different way, there are lots of things that have been identified as risk factors for these emergence events to occur: ecological change, agricultural development, urbanization, trade, globalized industry, and so on. And if you've been reading the papers over the last 2 years, these have been discussed ad nauseum around COVID-19, of course. And the emergence of pathogens into humans is linked largely to non-human animals and the biology of those non-human animals. And the graph on this slide, published by Koresh and colleagues, really illustrates very nicely that there's an awful lot of biology and interactions and stuff going on the left-hand side of this graph. And by the time we see things emerge into the red bit, which is the human population, so much has already happened that it's kind of too late to stop it. And so really what I and James are trying to emphasize is that understanding that the biology of these organisms in that period before they spill over into the human population is really quite essential. Okay. I also want to talk a bit about the concept of the interface. I'll come back to this word many times in my presentation, and it's a really important thing to understand, concept to get your head around. this is an interface. This is a beautiful image of an interface in Nairobi between a golf course and a low-income settlement. And an interface is described as a point at which independent systems or diverse groups interact. And ecologically, for biologists, it's very often, or most often, a physical place. It's that, what you see in the diagram, in the image there. It's the edge or a boundary between two very different kind of ecologies. And when we get disturbance at that boundary, when people or animals interact at that boundary, when organisms exchange genetic material at that boundary, or compete for resources or so on, then we get the transmission of pathogens. And in ecology, this is kind of described as the edge effect, the tendency for increased variety and diversity at those community junctions. But what I've learned in my collaborations with Julio and his colleagues is that there's a very different definition of interfaces also. In sociology, an interface may not be a physical place at all. It's been described by Long as a social interface being a critical point of intersection between different life worlds, social fields, or levels of social organization, where social discontinuities based on discrepancies in values, interests, knowledge, and power are most likely to be located. It's quite a mouthful, but really what's that saying? What that is saying is that there may be a physical interface, but there are also things around human interaction that are influenced by changes in our social organization that may not be rooted in a physical place, that have big impacts on the kinds of questions that we're discussing today. So for example, urbanization can have influences on economic and social transactions very far away from rural areas, yet those social transactions remain part of the urban interface because they are created and influenced by it. Okay, so the biological interfaces, the physical ones that I as a biologist spend a lot of my time studying, are influenced by the societal interfaces within which they exist. So the physical world that we're measuring, to put it a different way, is influenced by the non-physical societal interface. And that's really, really important, because it means not only do we have to understand the biology, but we have to understand how people interact with that biology, how they try to change it, and how the social world that is created around humans is influenced by the biology around them. So really, we have to integrate across disciplines. And if we fail to do that, we're nowhere in the future. And pandemics aside, we've learned this, and we must address that issue of integrating across our disciplines. Also, within all of this is the context of massive demographic change that James also touched on. In Sub-Saharan Africa and in Kenya specifically, the population of the country in Kenya will be 50% urbanized by 2030. That's huge. If you think about 20, 30 years ago, how much less it was, and imagine the rate of change that has had to lead to that. It's an incredible social upheaval. And if you think about what I discussed earlier about interfaces, that social upheaval in the context of biology is having impacts that we couldn't possibly have imagined. And agricultural systems are, of course, evolving to keep up with that demographic change. And so all of that demographic change is influencing human welfare, healthcare provision, sanitation, demography, all those things listed there, and disease transmission is really important. Okay. So the world is urbanizing. That doesn't mean that the rural areas are depopulating. And I think it's really important to remember that. The population of rural areas is still growing. It's just that the urban population is growing at a much faster rate. So what that tells us is that we mustn't neglect those rural areas, which, by the way, are also urbanizing in a slightly different way. I'll get to that in a moment. And in favor of simply focusing our attention on urban conglomerates, because everywhere is growing in terms of population, and what's happening in the urban areas is seeping out and filtering into the rural zones. So this graph from McKinsey, I think this map shows very nicely how what I'm describing is generally a sub-Saharan African phenomenon. There are many centers of population that are growing very rapidly in sub-Saharan Africa. And we neglect this obviously at our peril. The pie charts, simple pie charts on this, hint at what I was suggesting in the previous slide. If we look at what might be termed middle class, and there are many ways where how this can be defined, but in this particular context, it's defined by food consumption and income that is available to spend on non-essential food. Okay, that's one of many potential definitions. So I'm sure we can argue a lot about what we might define, but the point here is that if we take this particular definition, we see that rural areas have more such middle-class people than urban areas in them. So these are total numbers, or proportions, sorry. So more than half of those people who are termed middle class would be in the rural areas. And if we extend that to the non-vulnerable middle class, so those people who are much more comfortable and who are not on the brink of any of moving between classes, even then, 37% of those people are in rural areas. So we neglect rurality at our peril, even though we focus on what's going on in urban settings. And so really what I'm trying to say is that we have to understand both, and the rest of my talk, I'll really be talking about the linkage between that rural and that rural population and that urban population and how that impacts on disease. So here's a kind of schematic of that. The rural place, if you like, is this gray square in the middle. Can I get my pointer? Here, this gray square in the middle where the kind of rural interactions take place, but that rural area is heavily influenced by the urban and heavily influences that urban in return. And the environment is influenced by what's going on in this rural area. It's influenced by what's going on in the urban area. And the changing environment has a direct influence on how things change, evolve in both of those settings also. Okay, and so we can link these two populations through this concept of the value chain, which in some of the programs that Julio and I have been involved with, we've spent an awful lot of time focusing on. Really, these are, I'll shoot through these few slides quite quickly. This is a cartoon that shows how a farm might be connected to a household in a rural or in an urban area through a whole range of intermediary nodes, abattoirs, butchers, transporters, basically the complex food system which supplies everybody. And that value chain is heavily influenced by the social structures around it. It's influenced by national laws, by local laws, by informal networks of people who control how things are done in one place or another. And all of this forms the value chain which connects the urban to the rural and the rural back to the urban also. Okay, I won't talk too much about this in this talk, but what I also just want to say in passing is that we've also spent a lot of time understanding how these value chains are in of themselves an ecological system that deserves attention. And these pink blobs represent microbial isolations of diseases or pathogens of concern that we might be interested in. So we can study these value chains in of themselves as they have their own ecology, is really what I'm saying. I won't talk too much about that here. Okay, this is a idyllic rural setting in Western Kenya. It's a household surrounded by lovely countryside. And this is the interface where my understanding of pathogen transmission all happens. Within this, we have a household, the house itself that is interacting with its environment. We have the animals that people keep, a diverse range of animals that interact with the wider environment in which they're kept, with the water sources, with the food that they're given, with the neighbors, with the political system that defines how they should be kept and fed and so on. There are the people who are, of course, in many ways influenced by all sorts of things, who are interacting with their animals, interacting with their environment. There's the wider environment that's directly around these people, where the bats are that James was talking about, where the other peri-domestic wildlife species are living and thriving in the waste or in the environment that people have created. Okay, so this is the interface at its heart the agricultural interface where disease transmission can happen. And this interface is connected, as I've been describing, to places far away that perhaps even the householders can't even imagine, through the food system, through what they're growing, going off to the city, going off to local town, even just to the next door village, moving through a food system that these householders don't control and that has a life of its own, influenced by all these rules and these other networks. And this is my team sampling in an urban household, and they're looking rather jolly on that day. But really what I want to say is that the urban households have the same kind of microecology around them. You'll see there's vegetation, there's livestock, in this case chickens, there's the sheds, you can see animal waste on the floor. There's a mist net hanging there between those two trees where we were catching bats and birds. So that all of the ecology that I've described in that rural setting, it also exists in and around these urban households as well. So they are connected more than we imagine in terms of their interactions with interfaces around them. Okay. So while all of this exists, these households in general, as populations urbanize, are changing. What does it mean for everyone to be able to eat in a country or on a continent where half the people are no longer living on farms? It means that those farms that remain have to supply a much greater amount of food to the non-farming population. Okay, so agricultural intensification is the direct consequence of urbanization and demographic change. So on the left-hand side of this slide, you see, in this case, they're all poultry farms in a smallholder, very informal setting. And what you see on the right is what those farmers are moving towards, particularly the clever business-minded farmers who want to do well and succeed in their farming, are identifying these opportunities, investing money that they're getting. We're doing lots of studies actually to look at where that money comes from, and investing in more intensive, sometimes extremely intensive poultry farming, but usually kind of semi-intensive poultry farming to feed the demand that comes from elsewhere. And this is a similar picture in the pig industry. Instead of having 1 or 2 pigs, you now have 20 pigs and build a shed for them, and it becomes a semi-industrial farming business, but that we would still recognize as smallholder farming, a mother and father and their kids kind of farming system. We're not yet talking about commercial intensification. That's a different story altogether. Okay. So in the context of all of these things that I've mentioned, I want to talk through some examples of what consequences these kinds of changes in intensification have. So my first is the example of the truck, the trade, the dog and the liver. So this is about a parasite called Echinococcal granulosus. Don't worry too much about the details, but really this is a parasite that in some parts of East Africa is hyper-endemic. It's a very significant health problem, but in other parts of the country, it's absolutely not been seen before. It's not something people have really ever worried about, including in those areas where that rural slide that I showed you was from. But those rural areas are evolving, less people there are farming, more small towns are growing up around those farming systems, and there is a demand for meat products there which the local small-scale supply cannot meet. And so pastoralist regions in the northern part of Kenya are now selling their animals not to urban Nairobi, but to rural parts of Western Kenya on the Lake Victoria Crescent ecosystem, because there are too many people there desiring beef effectively for the local production system to provide it for itself. So we see a rural to rural trade effectively in cattle that are moving through markets and then into abattoirs. And we've done a lot of studies. This is a complex parasite. I won't go into its biology in a lot of detail, but suffice to say that dogs eating waste from those animals are key in the life cycle of this pathogen. And we've done studies looking at the ecology of these dog populations, how they move around. And their movements now are very linked to abattoirs where animals infected with this parasite are coming in, where the waste livers primarily, which are infected with the cysts of this parasite, are being thrown out the door effectively for the dogs to eat. The dogs are picking up the infections and then are interacting closely with humans and transmitting the infection to humans. And these are scans of people's livers that are infected with this parasite. So 10 years ago, this parasite was totally unknown in this area of Western Kenya. And now we've basically been watching the emergence. This is an emergence event. I use exactly the same words that we would be used in describing the emergence of COVID into the human population, but it's a much slower process. This is an emergence event driven by growing human population, an urbanization of that rural area, and changing supply chains and value chains that are bringing animals from faraway places for these people to eat. And that's creating a public health problem. My next example is around camels. Northern Kenya actually has a population of 3 million camels. It's one of the biggest camel keeping countries in the region. And in this setting, you may have heard of a virus called Middle East Respiratory Syndrome coronavirus, or MERS. It's a bit like COVID in some ways. Interactions between camels and bats is how that virus emerged. And we happen to be doing lots of other work on camel health in northern Kenya. And we used that as an opportunity to screen the camels that we were working with for this particular virus. And through biobanks that we have at the Institute, ILRI, International Livestock Research Institute, where I'm based in Kenya, going back to the 1970s, where they're banked samples from camel projects that have been done over the years. And we see that while this was a new emerging pathogen that emerged in the Middle East and came to global attention only very recently in the early 2000s, actually camels in this region have been infected with MERS or MERS-like viruses back for 30 or 40 years. And so there is a huge population carrying these viruses, even though it emerged into the human population, some genetic change happened and it emerged into the human population in the Middle East. Now, these camels that people are keeping are being kept in these dry pastoralist regions where the climate is changing and where there's less and less rain. So there's more and more impetus to keep camels. But at the same time, urban populations are demanding that camel meat. And this picture of the meat there's a Carrefour, the big French supermarket chain, is in Kenya, and they are selling camel meat that is coming from these regions. And there is a huge market for camel milk also in Nairobi, a very big population, a big demand on an industrial scale pretty much. And that creates a new value chain, bringing camels and their products into contact with urban populations. And what does that mean when they come into contact? I talked about value chains earlier. It means that the camels are moving through a supply chain system to meet the demand, where the system itself is not designed to cope with the numbers of animals that are moving through it. And so we end up with a situation like this, where this gentleman is slaughtering animals and handling their products in a way that would be okay in a very small scale, low throughput system. But now that the system is really high throughput because of demand, but the system hasn't kept up with the processes within the system haven't kept up with what's going on in that system. And so people are being exposed occupationally to these kinds of risks. And we see, even though there aren't outbreaks of MERS, thank goodness, in Kenya, we see human seroconversion to MERS coronaviruses amongst people who are working in the meat industry. Okay, and I realize I'll be running out of time soon, so I'll accelerate the rest of what I'm saying. My next quick example is around a disease called cysticercosis. It's also a helminth parasite, also has quite a complex life cycle, which we don't need to worry too much about. But in the context here is that, as I described, people are moving from small scale agriculture to a more intensive scale of agriculture, and what goes on their farms is now impacting populations much further away. So on the right here, you see the kinds of ecology that the pigs are being raised in. It's very, very unintensive, but those pigs are then moving through a slaughterhouse system, moving through a value chain. In this environment where they have been raised, they are at great risk of picking up this parasite, which they pick up from eating human feces. And they then get cysts in their muscle tissue, which then, if eaten, transmit the infection onto people. And sometimes those cysts move to the brain and cause a disease called neurocysticercosis, which is the most important cause of acquired epilepsy in pig keeping parts of the world. So I don't intend this to become a biology lesson, but the point is to say that pigs raised in that kind of agricultural system, feeding through what is becoming a more intensive value chain for this meat. The demand is huge. This is a picture of the Pork City joint. It's got its own Facebook page. You can go and look it up. It's a very popular place for people to go and eat pork that's supplied from places which are very rural and very informal through a complex value chain. And eating products in this kind of venue, which have not been properly cooked, presents consumers with a significant risk of acquiring infection. Okay, so then there's lots of public health aspects to that. And I won't talk about this because I know I'm running out of time, but I just want to say, James mentioned the dairy industry, and we see exactly the same kinds of things happening in the dairy industry, except that a lot of the cows, as you'll see in that top picture, might be kept not in rural areas, but in peri-urban areas, because it's this fresh product that needs to come to the market very quickly. And so we have these very complex value chains again around dairy, that both dairy that's raised in rural or raised in urban, feeding, mixing around, the whole value chain is very horizontally connected for the dairy industry. And the demand for milk is very high. People using antibiotics because of the way in which animals are raised is quite dirty in many instances, and so the wrong antibiotics are being used in many settings. So the reasons for using those antibiotics is inappropriate, and the waste that is resulting from that peri-urban production is being mixed around by peri-domestic species that use that waste. So sorry to pass over these things a little quickly. We can perhaps come back to it a bit more as we go. But the waste produced by this kind of farming, either in urban or in rural areas, creates an environment where these peri-domestic species really thrive. And they then create connections between households, between people, and transmit infections or multi-drug resistance in bacteria between different households and different populations extremely effectively. And so the peri-domestic species play a key role in moving these things around. Okay, so to summarize, these production systems are central to the ecology. Livestock production systems are central to the ecology of many zoonoses. We as humans and our livestock live in intimate contact with each other and with the environment. Animals that are produced on farm reach these much greater distances now as populations emerge and intensify. The reach of diseases has therefore changed massively. And there is a need, as James was also saying, for disease surveillance throughout those systems. And policy needs to follow that surveillance, and in order to allow it to be properly implemented. We need to obviously also understand a lot the costs of doing that kind of surveillance, and who pays, and not overburdening the poor farmer with the costs of that surveillance, which often is unfortunately what happens. And to understand these very complex systems as ecological and sociological complexes, and understand them in this integrated way. So coming back to that biological and societal interface that I mentioned. And then just to finish very quickly, to say that none of this type of work can be done without significant infrastructure, which requires significant funding, without significant interaction with the people who are affected by these things. And a lot of time has to be spent going back to those people and talking about the work and the implications for them in their daily lives. And we do a lot of that. About training the next generation of people who are going to carry on this kind of work. And a huge number of collaborators who are essential, whose intellectual contributions are key in bringing diversity to the thinking that we do. And it's a big team effort. So thank you very much. Sorry for slightly running over time.
No, thank you, Eric. Fantastic. And it is important, the collaboration that's behind this kind of, not just multidisciplinary work, but also transdisciplinary, really. I'm going to turn in a moment to Julio and to Nyokabi for some comment, because Julio, I know, will want to comment on the issues around urbanization and so on. And Nyokabi will want to comment on the health in food chains and on issues to do with surveillance and so on, which are his areas of expertise. But James, I'm going to just talk to you and Eric just for a second. So when you showed that rather wonderful map of the world, and we had various hotspots, there are two things that I noticed that I think the audience might like to have some clarification on. So one is, why is this picture so lumpy? It's very lumpy, isn't it? There are large parts of the world which just don't seem to be there at all. And also, why is the United Kingdom got these large hotspots in it? It's not, I mean, given that we assume that the value chains are a little bit cleaner here, that they're a little bit managed, that we do have a health system, even though it's been under pressure with COVID-19, etc. So what's that about?
So one of the greatest challenges of doing this type of study is to take out the biases, because the more you study things in an area, the more you'll find. Because actually these things are much more common than we realize, because so many infections spread to humans. Now, Kate's group did a great job of adjusting for the 4 biases, but I think there is still a proximity to a good lab bias inherent in every approach there. So the UK may be higher than other parts of Europe, or it may not be, but I think that one of the reasons why you see some of the hotspots in Europe and the eastern seaboard of the US actually probably relates to a surveillance bias. Despite the efforts to control for it. The other, the biases around different parts of the tropics around the global south are I think, hard to quantify. And I would never use a map like this to try and specifically identify, oh, that place is dangerous and this isn't. I think what they may be useful for is identifying at a crude level, a global trend, a global picture, and I think that the emergence of disease in the tropics is something that is a genuine thing, and I think that probably relates to the opportunities, the proximity between people and animals. In the case of that map, in relation to wildlife. Obviously, in this country, we've killed many of our wildlife, and they're relatively unbiodiverse. But I think those opportunities still arise with large numbers of people. But it's not it's a very imperfect system. But I think it's very helpful in terms of trying to pick up broader patterns.
So interesting. So it could be that the distribution of these potential emerging zoonotic infections across the world could be quite even, but we don't see that because we're not looking for them or we're not testing for them. So that could be part of it. And so that leads on then to a question I wanted to come back to, Eric, in relation to you, thinking about camels, which is something that I've become much more interested in because of my long history of connection with Kenya. But also because as a sort of citizen, I was quite shocked by the fact that we heard very little about MERS when MERS was a real problem just in the few years before COVID broke out, with a killing 30% of people who were infected, which is very much higher than COVID itself. And so you're reporting that in the camel population in Kenya for some time, there'd been a sort of underlying level of MERS infection. So what do we know about how something like that pops up suddenly or spills over, as James was saying? Do we know anything about how that actually came about in the Middle East and why it came about? And could we intervene before these things happen? You're on mute. I can't see if you're on mute, and I haven't got Vicky. You're on mute still, Eric, I think. That's it.
Are you there?
Yeah, I think you're there now. Did you get any of that?
Can you hear me?
Yes.
Good. Sorry, there was a blip, I think, for a moment. My interpretation of this is that MERS is something that it emerged into camelids some time ago and has found a very happy home in camels, and is a disease like the common cold, I guess I would say, for camels. They seem to get a very transitory illness. They'll shed virus for a very short amount of time, so short, in fact, that even if you're doing a longitudinal study of newborn camels and swabbing their noses every day, something that we would all have found a bit weird until we all had that done to us during COVID. It's still very hard to actually isolate the virus in those settings, even if it's so widespread. It's just such a transitory thing.
Yeah.
And so camel, and other studies, not just from Kenya now, from Jordan, from across North Africa, show effectively the same thing. Camels carry MERS. Something happened in the Middle East. There was the introduction of a different MERS-like virus from bats into camels, or some pressure in the camel population that led to a genetic change in the MERS virus that led to that virus being able to infect human cells, getting a spike protein effectively that was able to infect people. Exactly what made that happen, I don't know. Most likely it was an intense interaction between camels and people. Camels are kept in quite big farms and dairy industry and so on in those settings. So there is an intensification process associated with camel keeping in that part of the world. And that virus that acquired the ability to be more human infective came out of camels and into people, and then caused some fairly significant outbreaks around the world. So for me, the camel story in East Africa is one not of panic, because clearly it's not something we all need to panic about. We'd have known about it long ago, but it's one of the need for consistent and long-term surveillance, so that we're watching what's happening in those populations, so that when that kind of emergence event happens in camels, we're ready to detect it when it does.
Yes.
I hope that answers.
It does, but it's obviously it's a very tricky business, not least because, as James said in his remarks, actually catching these things before they have emerged is quite difficult. And once they have emerged, there is a serious problem at hand. And I wonder if we can...
So the key there will be to understand the risk factors for that emergence to happen. So we, as I've described, we spent a lot of time looking at occupational exposures among people who work in the camel industry and understanding the risks associated with that kind of work. And if we can decrease those risks with often very simple interventions, then we go some way in reducing the chances of those jumps maybe not happening, but of having significant consequences.
Yes, and so what's so interesting is, of course, is that it means that these spillover events are connected to things that we worry about in other parts of the work we do, which is, unsafe working environments and insecure livelihoods for people. And this is where the multidisciplinary thing comes in. I wonder if we could bring Julio in here at this point, and he's come off screen. Julio, are you there? Because this idea about intensification, and intensification being at the root of lots of things, of course, for an urbanist like you, produces, I imagine, quite a number of anxieties, not least because the latest thinking on climate resilient cities is that they need to become more intensive. So how do we deal with this?
Not only that, but it's as Eric was describing, in addition to urbanization and of globalization, which of course is what makes the speed of transmission of viruses like SARS-CoV-2 or SARS-CoV-1 for that matter faster and more possible is globalization and trade and travel and tourism. So and one of the keys is prosperity, which is in the title of IGP, which is that with urbanization come also a degree of increased wealth, modest in some cases, very large in other cases, sort of some people who can isolate themselves, as we've seen in African cities, isolate themselves in gated communities and leave the city for more cleaner environments, but the vast majority of the population cannot isolate themselves. They live in dense environments, often environments where in which they have very little control of, where they have these are the informal settlements, and in this fascinating project that Eric very kindly invited us to work with, we visited several of these settlements, including Viwandani, and you could see how people were keeping the livestock next to them, the pigs, the chickens, of course there were dogs, and all these processes that James and Eric have described so eloquently. It's very difficult to isolate people from that reality, and it comes with the intensification. What cities do is essentially they're fantastic places at attracting people, creativity, and therefore productivity increases, but they come at a cost. And the cost is, if you've got a very large informal population living in settlements like the ones I've described, and I don't think there was a picture in Eric. Eric usually has a picture of a slum somewhere in his presentations, but not today. But that kind of environment where people are coexisting with animals and in high densities are fantastic environments for the spread of diseases. So unless we tackle informality in that sense, and unless planning, and I want to go back to the issue of institutions, which both James and Eric raised, it's what institutions do we have to monitor these processes early enough so that we can catch them and prevent any outbreaks, but also be flexible enough to actually understand the realities, the social and economic realities behind these processes. Planners in sub-Saharan Africa are amongst the most conservative professions in the world. I mean, they because they're inheritors of modernist planning, where you've got land use separation, you separate users, and the principle behind it goes back to the roots of modern urban planning, which are essentially public health concerns. You needed to separate users, you needed to separate contaminated water from clean water, which was what gave rise to the cholera outbreaks in London and elsewhere in Europe in the 19th century. And that's at the roots of it. It's public health. But if you take it to an extreme and you say, well, we cannot have urban agriculture in cities because they don't look fine. If the fact of implementing these complex, expensive plans means that the poor cannot live in these areas that are properly planned because they're far too expensive, because the minimum size of plot that you demand is far too large for them to afford. If the system of the government is doesn't have the resources to produce housing for the poor, then they're constrained to living in informal settlements in the conditions that I've just described. So planning and the lack of flexibility of planning, the lack of foresight, the lack of incapacity to realize these social realities behind it are at the root of a lot of these things. And the other element, which I think is crucial in all this, is food security and cities. And that is only turning into an even bigger threat with climate change. Somebody, because I've been kicked out several times of the system, unfortunately, I don't have a very good connection in North London, unfortunately, but so I'm using my phone now, so hopefully it'll be more stable. But I've lost the list of original questions, but one of the first questions asked to Eric was about climate change. And I think it is important to bring the notion of climate change and what is coming ahead and for us in this. But one of the pressures for producers, and we saw it in the pictures and the examples that both James and Eric gave, is to produce cheaper and cheaper food. And we see it in rich countries. We see it in Europe. Food has to be cheap. And the pressure on producers from supermarkets, in the case of UK, which dominate the trade and distribution here, is to produce cheaper and cheaper food. Of course, that comes at a cost. The only way of doing it is by packing more and more animals together, which of course increases the risk of disease transmission. So, and there's a reality: the poor in cities actually cannot afford expensive food. So there is a whole element of the research that Eric described and Michael mentioned, where we looked at, with some colleagues, looked at the way that the poor consume food in prepared foods in informal settlements. And perhaps Eric, you can sort of mention that, but it's fascinating because the density in these human settlements are such that people don't have space to store or have a kitchen where they live. Therefore, they eat from street vendors. They eat prepared food from street vendors, which of course carries a lot of risks in terms of infection in the way that the food is handled. I want to leave it at that, and maybe we can come back to some of these
Sure.
issues, I mean, because that raises a number of questions that for both James and Eric.
Well, maybe we should just bring Nyakabi in here, because Nyakabi, you know, you've done quite a lot of work on what's happening in the food value chains in Kenya and other places, and also on issues to do with biosecurity and surveillance. I mean, one of the things we've heard less about perhaps today so far is, you know, what are the role of people who are the ordinary sellers of food in those value chains, or the ordinary farmers in this sort of, if you like, this the question of how surveillance should be done, how we produce better quality food, how we manage health of people better. I mean, what's the role of those ordinary citizens in all of this process?
So I'll start by thanking James and Eric for a very wonderful talk. And yeah, it's really interesting and thought-provoking on some of the issues they mentioned. And as a person who's really interested in food security, I'll try to add a few things, and maybe I'll pose 2 questions to James and 2 questions to Eric.
Okay.
Yeah, so it's really interesting to see, and especially what Eric has shown on the issues with food like of value chain. And I know it's a really big problem, especially how do we navigate between the intensification, because yes, we need cheap foods, but also how do we produce the food in ethical ways so that then we don't have to sacrifice quality for something that is cheap. And for me, that's why like I find, and maybe Eric can comment on this, especially how do we govern food safety issues in value chains, especially in limited resource settings, like what happens in low and middle income countries. A good example is Kenya. So you have so much emphasis being placed on what Kenya exports, but I don't think you have the same energy and zeal going to what happens in the local market. So that for me will be very interesting. If Eric, you can like maybe when you come back, talk a little bit on that. On the other issue is like, I think will be on biosecurity. And Eric showed a very interesting like a slide with a lot of antibiotics that are being used to produce animals. And I don't see a lot of studies. Everybody focuses on improving, like increasing food production, but I don't see a lot of same energy being put on informing farmers or training farmers on biosecurity, which is really common in Europe, especially UK and other places. I've not seen that much happening in Africa. So maybe James and Eric can give us maybe an overview of what's happening. And then I'll ask James an interesting question, like it was really interesting talk. And there's this thing you said about the role of primary healthcare. And for me, then it becomes looking at especially what's happening with COVID. We realize that like primary healthcare then should be seen as a global public good. Whereas what you see, like especially at policy level, is with the IMF and World Bank, with all these austerities measures, is more cuts going to the healthcare. Then what should at global level and especially at policy level, then what should we be doing to address some of this issue if we need, because now we are more like a global village. So you can never like wish away what's happening in the tropics, because then everybody's connected. And last question I think should be for Eric is, how do we navigate this interface? And I'll use the word that you used. Like you need like food security, but at the end of the other side is also we have to balance it with the need for like reducing the risks that can come out of that interface, especially in urban settings. And I think James also said you had the same issue about bats in Ghana. How do we navigate? People depend on these value chains and this kind of like for their livelihood, but on the other side, you have all these risks can come out of it. So maybe you can expand on that one.
Okay, so perhaps I could, there was lots of very good questions, lots of very good ideas there. So could I, what I'd like to do, if everyone's in agreement, is just go back to James and Eric and Julio and just get a brief comment on the issues raised by Nyakabi, and then go to the floor, because there's a sort of tsunami of questions building up from the floor, and they want to give them a bit of a chance to come back as well. So James, don't feel you have to answer every one of Nyakabi's searching questions, but just pick something that you would like to get your teeth into.
I'd like to sort of pick up a couple of things. So I think the only way that the issues around primary healthcare being addressed, as you say, I believe it to be a global public good, is through international political leadership. A very clear recognition of this. And at the moment, I don't think that it is sufficiently on anyone's agenda. And I think that there are huge issues around claimed compliance with the international health regulations, which the WHO's international IHR, international health regulations, where many countries will have the ability to demonstrate they have all of the different components, but without primary healthcare and without the connectivity and resourcing of the more high-tech end of the IHR, I think that those claims are not strongly enough evidenced. In relation to what you were saying, I mean, let's pick out, stay on the same broad area and let Eric deal with the zoonoses questions more, but around livelihoods and being a driver for disease, or certainly for exposure. I think that if we recognize that poverty is one of the greatest risk factors for infectious diseases, this also adds to the very clear development agenda, which this country was doing quite well in until the last year or 18 months. And I would like to see leadership from this country re-emerge and the ODA cuts be reversed. But I think that that it's impossible to see zoonoses disappearing without better development globally. And it's not just the responsibility of this country, but I think that countries like the UK can make a significant contribution to try to bring others with them. Thanks.
Great. No, thank you very much. So Eric, could we turn to you and see which of Nyakabi's provocations you feel like picking?
Yes. First of all, here for what James was saying on the ODA cuts. I think it's left a tornado of destruction in its wake, and it's very difficult to handle sometimes. So one of Nyakabi's questions was about food systems and how in these evolving markets, as we've described, how we can ensure safe food. The first thing I'd say about that is actually not to underestimate the power of consumer pressure. It's not just people with Tesco club cards who have consumer pressure. It's everyone everywhere who spends their money to buy food. And in Kenya over the last few years, there have been some very significant outrages around food safety. I mean, one, for example, I won't mention the name, a company that makes burgers that applied different rules around the sourcing of its burger meat here in Kenya compared to globally. And as a result of that, it has absolutely not been able to establish a foothold in this country because the consumer pressure was such that people just kept away from buying their burgers. Also, big outrages around how food is raised, the use of additives in food, how food is transported, even the welfare implications of certain types of food system, raising very significant issues in the media with pressure groups on Facebook, on Twitter, on WhatsApp, and these things mustn't be underestimated. They have a direct impact on the bottom line of those industries. And so that is strong, I guess I would say. On the other hand, there is a group of people, those people who are buying the fast food, I guess we call it, the street vendor food in the low income settlements have very little choice about anything that they buy. They can basically buy what's in front of them as they walk home from work. And those people have much less power. So there is an imbalance within populations of a given country in who can try and apply change and who can apply pressure. But I would say in the end, it's really about giving choice, and choice leads to improvement in the end. I mean, we did a study looking at, in low income settlements, looking at butcheries, and we put in half the butcheries, we did a trial, half the butcheries, we controlled the flies by putting special netting that killed the flies, and the other half of the butcheries, we didn't put flies and netting. And over a period of a couple of months, all those butcheries, which were all serving the same socioeconomic group, the ones with the netting got a significant number more of amount of custom than those without the netting. Very simple intervention, because people perceived an improvement in hygiene associated with that. So those people are relatively disenfranchised. They don't have much choice, but when they have choice, they exercise that choice, and that choice has an impact on the people who supply them the food, who then make better commercial decisions about the way they're going to supply. So I guess a big part of the answer, it's not the whole answer, and it would be oversimplistic to suggest that it were, but a big part of it is creating choice and creating information so that people use that information to vote with their pockets, I guess is what I'd say.
Okay, oh, good. So fly nets. Okay. Julio, you'd like to just come back there?
Not a lot, because I realized the real experts are Eric and James. I'm not.
But just on the urban. Did you have anything you wanted to add on from the urban?
To add to what Eric was saying, which adds to what I said earlier, and that's as populations urbanize, and provided the information systems are there, there's a certain openness, or not, as the case may be in the case of China. The populations will become aware of what they're eating, and become more demanding consumers. But one question, in fact, that sort of looms in the air for Eric and James is the issue of eating exotic species and the value chain, the chains of transmission that led to the emergence of SARS-CoV-2, which presumably came from bats. But that comes from, presumably, we think, and we, as James says, we never know, we will never know, from the appetite of wealthy consumers, not necessarily poor consumers in China, for exotic species, even some that are coming as far away as the Amazon, because there is a cultural interest in sort of exploring these strange meats or strange animals and so on. And that is a worrying thing, because it's not necessarily linked to poverty. It's also linked to cultural habits and preferences, which actually, so maybe one quick comment from either of you would be interesting in that respect, to what extent that happens. But also the other link to that question is, we're seeing increasingly in the rich countries, certainly amongst the middle classes, a move towards away from meat and more to plant-based or vegetarianism. I know in Sub-Saharan Africa, and certainly East Africa and West Africa, meat is very much at the center of the aspirations of anybody from poor to the middle classes. And do you see that changing in any way? So these are two questions to Eric and James.
Okay, good. Well, we have actually, and we can skip down to it. We have a question in the chat, which is about that. A good question from Andrea Rigon from DPU's, also talking about, pre-colonial Latin America having relatively few zoonotic diseases, and that had something to do with perhaps low levels of domesticated species. So that's a question for you. But then asking about, shouldn't we all go vegan, right? Using less land for animal agriculture and let nature thrive. And so these arguments were the points Andrea raised, important there, but connected, I think, to the point that Julio's just made. So if James and Eric, if you'd like to comment briefly on that, we can go back to the top question after that. Yeah.
Very briefly. In one region, a an exotic animal is a European exotic animal is a normal indigenous part of the fauna of the area. So we've got to be very careful about the nomenclature here.
Mm-hmm.
If we're talking about risks coming from whatever is meant by exotic animals, i.e. not a cow, a sheep, or a goat, or a pig, or a chicken, then the risks that you describe, Julio, I believe, do not come from consumption, but they come from trade in live animals. And I think it's really important not to blur those two things. Local consumption of bushmeat, or whatever you want to call it, which may be an exotic meat for Northern Europe, is part of traditional indigenous practice, which should not be regarded as something that is necessarily particularly risky. Whereas trade in live animals and their infections and the infections they pick up from animals that they're mixed with is entirely different. If we're talking about whether domestic animals are a very important source of infections, either as giving rinderpest gave us measles. Rinderpest of cattle gave us measles, remember that, and there are many other examples but also we've got to remember that agricultural animals, because of their close contact with humans, play this very important bridging role from wild animals or from other species. So yes, agriculture is risky. There are many reasons why it's bad for the world that we eat so much meat, but the global trends for meat consumption are increasing. And it's difficult to see them being reversed. If you accept that they will not be stopped, those trends will not be stopped overnight, then we need to look at farming more safely. And actually, in some ways, extensive systems are riskier than very well managed, very biosecure, more intensive systems, which also have huge advantages in terms of land sparing. Because of efficiencies that can come through those intensive systems. So we have to be very careful to determine exactly what we mean and what we want to get from a food system before coming up with the intensive bad, extensive good, because actually extensive systems that involve long distance movement of lots of live animals are probably the last thing we want to do, particularly if they involve deforestation, be it in Australia or be it in Brazil, in order to make the land clear enough to grow your cows. That is an extraordinarily bad thing, both for biodiversity loss, for carbon budgets, and for disease emergence risk. Thanks.
Eric, do you want to come in there?
I guess I agree, and the only thing I would really add is to emphasize this issue of trade. When one moves things around, then we create risks, and if we have to move things around, we have to manage those risks better and foresee problems that might arise. As James was talking, I was reminded about the outbreak of monkeypox in the US when people were importing from Ghana, I think it was, James, certain species of rodents that they like to keep as pets, and then they escaped and infected local fauna in the US, and there was potentially a big outbreak. It was put under control quite quickly, but of this exotic viral disease of West African rodents that was in the prairies of the US. And that's because people wanted to have these exotic species in their home and cuddle them. And so it's not always about food. We create simply by our social organization and the things we like, all these kinds of risks, which we need to manage better. And we need to understand why those things happen. We need to undertake much better surveillance around those kinds of risks. And we need to prepare ourselves to react when those risks arise. Yeah.
Okay, thank you. Well, let's segue back now to the top question that we had tonight, which is an important question, and I think it's to James as well as to Eric, although it's addressed to Eric. So it's from Jackie McGlade, who's professor in the IGP, saying, "Hi, Eric. The last time we met was at the International Livestock Research Institute. Can I ask you how you see climate change and zoonoses affecting the plant-animal interaction?
Yes, so we often talk around about this concept of One Health, how humans, animals, and environment are linked together, and there is an extent to which the plant kingdom is neglected from that paradigm, I guess I'd say. So on the one hand, that plant kingdom is affected by larger scale processes like climate change, and what's happening there is a function of changing ecology, and that changing ecology has impacts also on the animal species that feed off, live in, or otherwise use those plants. So there is a close interaction between what's happening in the plant kingdom and the animal kingdom that we're primarily discussing today. That's the first thing to say. And actually, the way I want to just think about your question quickly is, and hi, Jacqueline, by the way, is to say that climate change in the context of Kenya, for example, is resulting in ecological change that is creating conditions where invasive plant species are more likely to thrive. Okay, disrupted environments. Now, if you go for a walk in the UK and you rub your legs against nettles, and those nettles are a sign of a disturbed environment. Okay, and so disturbed environments have their own microecology and their own species that are able to capitalize on that disturbance. And in many parts of the Central Rift Valley, for example, we see invasive plant species taking over, and those invasive plant species are excellent hosts for mosquitoes, which transmit zoonotic arboviruses. So those of you who aren't biologists may not realize that mosquitoes not only feed on blood, but half the time they're actually feeding on plant juices, and the male mosquitoes are always feeding on plant juices. So plants are essential for the maintenance of mosquito populations. And these invasive plants that creating these habitats are creating habitats that these vectors like to live in, have compounds in them that result in the vectors thriving in those environments. And so climate change that has resulted in invasive species is then resulting in the thriving of vectors which are transmitting diseases like Rift Valley fever or the Zika virus and other things. So there's an intimate connection actually between those climate changes, the plant kingdom, and risks to humans through zoonotic viruses in that context. That's maybe slightly on the side, but I hope I've answered the question sufficiently to satisfy you.
Well, certainly enough to alarm the audience anyway. That's that's very good, yes. James.
I'm not sure that I've got much to add to that. I mean, I think the greatest concern with climate change are the vector transmitted, the insect, mostly biting flies or mosquitoes and midges and ticks, and how their distribution may change because of global climate change for many of the reasons that Eric has described. But also, if things get warmer, there are other parts of the world where these infections can replicate in their insect. In the insect vectors that already live here or there, and can transmit in areas that they haven't done before. So I mean, I think that the complex impacts of climate change are mostly going to be mediated, or most obviously mediated in vector transmitted zoonoses rather than necessarily the directly transmitted ones. But I think that there's so much change that is associated with climate change that the effects may be, and the effects of extreme weather conditions may be rather unpredictable in terms of zoonotic transmission. But anything that increases poverty, as climate change is likely to, will increase the impact and burden of zoonotic disease, though.
Yes, and there's just as a sort of an addenda to that line of thinking in a way. So Shemuel Yerushalmi is saying, what about cases where viruses and diseases pass from humans to animals? I mean, is this on the increase? What's happening to that?
Well, so we've seen in the last few weeks very clear evidence of COVID-19 transmitting to the common white-tailed deer of North America.
Really? Okay.
That's been widely reported, and then transmission in the deer. So yes, these things happen. They're recognized to happen. Some infections have effectively a two-host cycle, so there's constant cycling between humans and animals, which is a slightly different point. I think the other point I'd make in the early stages of an Omicron epidemic, this variant, it's been sitting somewhere for some months. It's quite possible that it's been sitting, if it's not in some poor immunosuppressed human patient. One of the sensible alternatives is it may have been sitting in an animal reservoir which was infected by humans. The virus is adapted in that species and then jumped back into humans, and that's quite a plausible explanation. There's no evidence for it, and so I think that we absolutely need to be highly concerned about things, because if an infection can jump one way, then it's highly likely it can jump back again.
Yes. Well, let's move on then now for everyone to think about a question from Samuel on Rockcliffe, who is a researcher at the IGP, and he's saying the structures of extant food systems tend to ignore or even marginalize the voices and knowledge of indigenous food producers. These communities are often more at risk of exposure to zoonoses, yet appear to have very little say in how food safety regulations are formulated. And so does anyone have any thoughts on how we might design more inclusive forms of food safety governance? So this is really a sort of an additional question to the question about primary healthcare. So primary healthcare is one level here, but the other is this inclusive forms of food safety.
Shall I start, James?
Jump in there because you've been working on some of this.
Okay.
So, yeah.
So this perhaps will sound simplistic, but for me, it's about empowerment of those populations to not simply be at the receiving end of someone else's policy, but to be actively engaged in that policy making process. That requires somewhat forward-thinking policy makers to engage with those populations. I think that happens in some places, and certainly not in all. But if the views, food production methods, dietary habits, and so on of such populations are represented in what is being discussed at a local, regional, or national policy level, then they can be included. And I think the problem in many countries is that they've been totally passed over in the need to create policy that meets the needs of industrial food systems. But I think there are examples of such populations being more included, and that obviously having direct benefits for them. Yeah. I guess that's, James, do you want to add to that?
I think Nyakabi wants to come in then. Nyakabi, would you like to come in?
So just to add on that one, I think in Kenya, we've seen that happen one or twice. So I remember, Eric can remember this one with the dairy one and also with the honey one, where people really got involved and to change some of the rules that were being brought in to favor the big industrial players at the expense of the smaller ones. So participation, and I think that will depend on the place you go, especially when it comes to governance. And I think in Kenya, as an example, then the public participation role is really being entrenched in our new constitution, which people should and can participate and change some of the things. To add up on one of the questions that was previously asked, should we all be vegans? I'll just say we need to look on things on case-by-case basis. I think one example is what actually, like from the slide Eric presented, and that one is some land cannot be really turned into agricultural land because then you'll have more negative environmental impact. So I tend to see like we should use land better for what is really suited for. If it's for agriculture, then let it be for agriculture. But also in the pastoral area, then that is the best way to upscale that resource there, that is the grass, into something that is worthwhile protein for human consumption, which cannot happen through cultivation. So just something small that I wanted to add.
Okay, well, we're coming close to the end of our time this evening, but I'm going to just as the last question on the chat from Charles Croydon, saying that he applied to attend COP26 on the issue of the $250 trillion global debt and its relationship to zoonotic disease. And for example, a year ago, Zambia defaulted on its debt and now has to clear more forest to grow more cash crops to service its higher debt repayments. So, do you consider such clearing of forest makes spillover more likely? So we've said that, we can come back to that issue and its relationship to debt. And also President Trump closed down the PREDICT program, which US Senator Elizabeth Warren opposed. And so that PREDICT program, as we know, perhaps audience members don't, was a project seeking to identify new and emerging infectious diseases that could be a threat to human health potentially. So, will Senator Warren have any traction now? So this is all really about the politics of where we are now and how zoonosis sits right in the center of it. So I think a response from Eric and James would be great, and Julio would be good too, and Nukabi, just very briefly as we come towards the end of this very good conversation. So, James.
I think clearing of forests is inherently bad for reasons relating to indigenous people's rights, climate change and carbon budgets, and probably also zoonotic risk, particularly if you're replacing trees or patches of trees with animals growing. So I think that it's a bad thing to start with. So should that be something that results from debt? Absolutely, we should be working very hard to avoid that. I think the politics around a rather different question around the politics of the PREDICT program and the specific funders. It's a very complex area. I think that there should be far more money as a result of this pandemic to look at the underlying causes of zoonotics, zoonotic emergence, zoonotic transmission, and I think that we could get buried for the next 6 hours on whether or not the PREDICT program was all good and uncomplicated. Yeah, but I think it's absolutely we should be looking much more carefully at this. At the moment, nearly all of the funding is going into pandemic response rather than thinking about pandemic prevention. And I think that should be changing. But at the moment, despite the fact that everyone's focused on the pandemic, that's not happening at the moment.
Yes, Eric.
I'd just add on the PREDICT program, and again, there's a lot of politics around what did or didn't happen around that. But just to note that the American government, the US government, have just funded its successor, and so they have put significant money behind a successor to that program, which is going to start next year. So if you're worried about that specific kind of effort disappearing, it's back on the agenda.
Okay, good. So it's going to be called something like PROMISE, is it, this new program?
It has a long contorted acronym.
Julio. Yeah.
I don't have anything to say about these two questions, but because Eric and James are the experts. But I wanted to say how wonderful it is to see this example of cross-disciplinary, interdisciplinary collaboration, and just to emphasize the fact that to understand these complex processes, we do need that kind of research. We do need that kind of collaboration. The project that Eric kindly invited me to be part of, invited us to be part of, was wonderful, and for me was an eye-opener, and I learned huge amounts. I'm not sure we could contribute as much as the geneticists or the vets to understanding the problem, but I think it is important that we do collaborate, and this is a message for the students. And I think both in IGP and DPU, we do run programs that are cross-disciplinary or multidisciplinary, and that understanding amongst different professions and cultures, if you like, research cultures, is crucial. And I wanted to sort of end with that. I'm sure, Henrietta, you would want to emphasize that too.
Yes, I would, and no doubt, Nukabi, do you want to say a word on that, since you are actually working on such a program right now?
So for me, I think just a little bit. I think So my hope actually going forward, we'll see more money going to what I think at IGP and also like I think Eric are doing on One Health, where we can share these resources, but we can collaborate more to understand the dynamics, these interfaces, and how we can make the world a better place and with less disease risks. So that's it.
Wonderful, wonderful. Well, look, we are out of time, as we often are in these wonderful discussions. I just want to thank everyone who's been involved. So our panelists, Professor James Wood, Professor Eric Fevre, Professor Julio Davila, and Dr. Simon Yakabi, and of course, Professor Michael Walls. And what just to say how much fun it is collaborating with all the people we collaborate with in these important projects, and also how much fun it is to have great collaborators so close to home in UCL as the DPU. And we are very grateful in the IGP that you are there and are collaborating with us. And so thank you very much for this first wonderful event. And we look forward to the other ones. And we can, I think, probably, I don't know where the rest of my team are, I can see an IGP thing in front of me, but at least I think we can give everyone a virtual round of applause. Thank you all very, very much. It's been a wonderful event. And thank you for coming and thank you for being with us. And I hope to see you all very soon.
Thank you.
Good night. Good night,
Thank
everyone.
you, Henrietta. Thank you for hosting.
Thank
Thank you, Vicky. Thank you. Thank you.